India continues to battle a crippling second coronavirus wave. Scientists think a fast-moving variant is fueling the crisis. The country has recorded 23.7 million cases and more than 258,000 COVID deaths. And what's happening in India could accelerate a global health emergency. Abhijit Banerjee writes about this in an opinion piece for the New York Times titled, "India's problem is now the world's problem." Abhijit joins me now. He is a professor at Massachusetts Institute of Technology and co-winner of the Nobel Memorial Prize in Economics. Thank you so much for being here, Professor. So what mistakes did India make with its first coronavirus wave?
I think it locked down too soon. And that means, and given that you can't lock down forever, especially in a country where lots of people work in the informal sector, they had to lift it pretty soon. So they lifted it before the whole thing was taking off properly, which gave the impression that, the lockdown was not important for, dealing with COVID. COVID just didn't seem to be so as bad as people had imagined. That was the first wave, and as you know, it's very different now.
Yeah, it's so interesting because you don't think about the lockdown as leading to this bigger spike later on, and in fact, we did marvel at how the numbers were so low early on. I'm wondering, did that mistake of locking it down early, or is it really the mistake of lifting it too soon that led to this more destructive next wave that followed?
I think the original lockdown, I don't think was not particularly. I don't think it had huge consequences for the the time pass of the disease because it was lifted too soon. But I think what really contributed to this one is the sense that. We don't actually know why, but the disease went away, and it's true. And I think I, someone who follows this carefully, don't know why it went away. So I think that I think made many people believe that somehow this is done now. And I think that's really played into the current wave.
You also mention in your piece that the government is hesitant to embrace a national strategy towards controlling the virus. What type of strategy do you think is needed in India now?
Well, I think the problem is that because the national government is not taking a strategy, is leaving it to the states. Some states are doing it, others are not, but that sort of undermines the whole thing. Since people travel, the disease is spreading somewhere, you have a lockdown, as soon as you open it comes back. So I think it really needs to coordinate the lockdown so that all of the lockdown happens more or less at the same time. Maybe some places where the disease hasn't spread, they can be spared, but there's lots of big pockets of disease which are less locked down than others, and I think that always is, as we know from the experience of the U.S., that the disease then comes back with a vengeance.
What more do you think the United States and other nations need to do in order to help India to not only help the people who are suffering right now, but also to prevent the virus from spreading to neighboring countries or continue to mutate and potentially become more resistant to the treatments and vaccines that we currently have?
Yeah, and that's the big question. Well, I think that getting vaccines to people is the way to stop it from mutating. I think if people are less likely to be infected, if the disease doesn't have quite as much space to play in, it's going to be less likely to mutate. Then I think there's the other question of how do I get it out of Africa? I mean, and I think there the answer is mostly, given that the vaccines are still going to not be there for a while, I think we need to think of what to do if it arrives and starts to spread like mad. I think it's not. And I think it's not even. I think it's quite likely that it happens. So that I think we want to think about not how to prevent it from getting there, but what to do if it does get there and start spreading.
All right, Professor Abhijit Banerjee, thank you.
Thank you.